This program is made possible by the support of Delta Dental, Quick Trip, Marshfield Clinic Health System, Wisconsin Counties Association, Wisconsin Hospital Association, Watch Wisconsin Eye on Spectrum Channels 995 and 363, and at wisi.org.
Medical Officer for the DHS Bureau of Communicable Diseases, and Ryan Nilsestun, the Chief Legal Counsel in the Office of the Governor. We'll begin the briefing with remarks from Governor Tony Evers.
Good morning, and thanks for joining us this morning. Before we turn to our COVID-19 update today, I want to take a moment to remind you to vote. The election this Tuesday is critically important. You have the opportunity to elect your elected officials at the local, state, and federal level, and several local referenda also. We need everyone to make sure their vote counts and their voice is heard. And because of this pandemic, we also want to make sure that you can vote safely. If you still have your absentee ballot, fill it out and return it as soon as you are able. At this point, we don't recommend mailing it because it has to get there by 8 p.m. on election day. Instead, you can return it to your clerk's office in an official ballot drop box and early voting locations. You can also find out if you can drop your ballot off at your polling place on election day by reading the instructions that came with your ballot. Make sure you know all the options near you to turn in your ballot by visiting myvote.wi.gov or by calling your local clerk's office. If you plan to vote in person, don't forget to mask up, practice social distancing, bring your photo ID, and if you need to register, your proof of residence, and maybe take some hand sanitizer and your own black or blue pen if you can. And if you're heading to the polls, make sure to be kind, patient, and express some gratitude, especially this. Express some gratitude to our poll workers and our clerks who are helping to do everything they can to make sure things run smoothly and safely. In order to help support our local election officials and to ensure they have enough hands on deck, we will also have about 400 Wisconsin National Guard members helping out as poll workers on Tuesday. Just as they always do, the Guard has stepped up when we need them, and we are grateful for their service. Yesterday, I was excited to also announce we are expanding our community testing efforts across the state with 71 new free community testing sites in 56 counties and 7 tribal nations. These sites have the capacity to test about 48,000 people each week. Testing is obviously a critical part of our state's response to this pandemic, and we want to make it easier for those who need to get a test to get a test. Distance is one barrier that we can do something about, and one of the ways to address this issue is to offer more testing in more places for more Wisconsinites. If you have any symptoms of COVID-19 or have been in contact with somebody who has tested positive, first of all, avoid contact with others and get tested, and make sure to let any of your close contacts know so that they can take precautions as well. But I also want to be absolutely clear here. Testing is not a silver bullet for stopping this virus. It's a supplement, not a replacement for all the mitigation efforts we need to have in place to stop the spread and save lives. On Monday, Wisconsin surpassed 200,000 positive cases of COVID-19. As Secretary Palmer has said before, it's going to get worse before it gets better. And that seems to continue to be true as our daily numbers are alarming. Our 7-day average of new daily cases is 4,128. 2 months ago, it was 684. In just these 2 months, the 7-day surge average has increased over 500%. And our 7-day average of daily deaths is higher than it ever has been before. Make no mistake, folks, every time you choose to stay home, every time you decline a party invitation, every time you get to take out instead of dining in, And every time you make another sacrifice after months of sacrifices, you help stop the spread. The choices you make every day could be the difference between preventing a hospitalization or even saving a life. So please, we ask everyone to stay safer at home. In the spring, our efforts to stay home saved lives, and we are in a far different and more dire situation now than we were then. Limit your travel to essential errands like a weekly grocery trip, picking up prescriptions, or going to vote. As we head into Halloween weekend, a time when many would normally be out and about in a different sort of face mask, please stay home. Avoid any in-person parties or get-togethers. Don't go to other homes or have people in your own home who are outside of your immediate households. Go trick-or-treating virtually. Host a costume party or scary movie night on Zoom, or visit a drive-through haunted house. Kathy and I will miss handing out candy at the residence for trick-or-treaters this year, but we hope you stay healthy and safe this Halloween and celebrate safely by staying at home. With that, I will now turn things over to Secretary-Designee Andrea Paul for her update. Andrea?
Thanks, Governor. Good morning, everyone, and thanks for joining us again. Since yesterday, we have added 5,096 new confirmed cases of COVID-19 to our total here in Wisconsin. Our 7-day average of new cases is now at 4,231. 1 month ago, it was 2,334, and 2 months ago, it was 696. In these 2 months, our 7-day average has increased by more than 500%. Today, our total number of confirmed cases stands at 220,092. 44% of our cases have been confirmed in the past month, 66% in the past 2 months. Hospitals in every region of our state are experiencing staffing strains, all while COVID-19 hospitalizations continue to rise. We currently have over 1,400 patients hospitalized with COVID-19 in Wisconsin. Our ICU beds continue to fill, and our alternate care facility continues to work with hospital partners and accept new patients. We've now lost 1,972 Wisconsinites to this virus. That's an addition of 24 deaths since yesterday. Families and friends across the state are feeling this loss for their loved ones, and our hearts certainly go out to them. We owe it to them, to our friends and family, and to ourselves to do all that we can to stop the spread of COVID-19. We need to stay home. We need to wear our masks and physically distance. We need to practice good hand hygiene. And if you have symptoms or have been exposed to COVID-19, please get tested. Call your healthcare provider or go to dhs.wisconsin.gov/testing to find a community testing site near you. After you get tested, quarantine while you wait for your results. Isolate if you test positive, and please notify your close contacts to encourage them to get tested and quarantine as well. If you test negative, continue to monitor your symptoms. Testing is not what stops the spread. Testing is what informs you of our plan as a state and of your actions as individuals. What we do after testing is what matters, and the safest choice is to stay home. Staying home is how we flattened the curve back in March and April, and staying home is how we can do it again. Thank you for doing your part to stop the spread and to save lives.
Thank you. We'll now take your questions. A reminder to maintain audio quality, to please keep your phones on mute until it's time to ask your question. And we'll begin this morning with Gretchen Elke from the Associated Press. Gretchen? Gretchen Elke? And we'll move on then to Rob Sussman from WTAQ Radio in Green Bay. Rob?
Hi, yes, good morning. I was curious about the death rate for COVID-19 in the state of Wisconsin. I know that nationally we're seeing kind of a drop-off in the death rate despite the increase in cases. I was wondering if we're seeing the same thing here in Wisconsin. Thank you.
Our death rate sits at just under 1% right now. But Dr. Westergaard, do you want to say anything about what we're seeing in that data?
Yeah, I would say as the number of cases has increased and the larger population is exposed to the virus, over time, what we would call the case fatality rate, the proportion of positive cases that have died, has gotten lower. So initially, when older individuals, people in hospitals and nursing homes were a higher fraction of our cases, the case fatality rate was high. Now that we have cases in all age groups, and younger people in particular, the percentage of people positive die, but the number of cases is rising. So the death toll is increasing. The important thing to understand about this virus is that there's a wide variety in the risk of severe disease, but anyone who's infected can become severely ill. And we've recorded deaths in all age groups over 20. So no one is that we know of is immune to the virus or is completely protected from severe disease, although the actual risk varies quite a bit in older people. So I think the short lesson is deaths are on the rise because cases are on the rise is the important take home.
Thank you, Rob. Now to Sierra Trojan from Fox 11 in Green Bay. Sierra?
Good morning, and thank you for taking my question. Are you planning to contact trace from President Trump's Green Bay event today?
So we contact tracing, right? It is about. It starts with a positive case, not with an event or a function or a location. And so anybody who tests positive, right? We are encouraging them to notify their close contacts, to encourage them to quarantine and get tested, that they themselves be vigilant about their isolation and quarantine while they wait for their test result, but recognizing, right, that our contact tracers across the state and here at the state level have more work than they can manage. We are anxiously encouraging those who get tested to help us with messaging to their own contacts as we work our way through the large caseload that we have. But right, it speaks more broadly to our gathering behavior. Right, we need to do all that we can to stop the spread, and that means limiting our contact to people who are in our immediate household. That means don't go to small gatherings. It means don't go to large gatherings, and do everything that we can through those actions to stop the spread so that our healthcare systems, our local public health infrastructure, our contact tracers can get to a place where we've got the bandwidth to do this really important work.
Thank you, Sierra. Now to Will Keneally from PBS Wisconsin. Will?
Hi, thanks for taking the question. I was wondering, Governor, if you could update us on any conversations you might be having with legislative Republicans.
I've had no recent conversations with legislative Republicans. I follow the news. I saw a clip that Speaker Voss had indicating that he's interested in meeting, so I'm interested in meeting with him. I don't think the meeting's been set up to my knowledge.
Thank you, Will. Now to Adam Rogan from the Journal-Times in Racine. Adam?
Hi, I believe this question would be for the governor. Bounce off that last question, actually. Robin Voss has talked about, he, I think, misstated last week that you had $75 million you could spend, but that you haven't. And then I learned the other day that you actually are not able to spend that money from the first coronavirus bill. Can you walk through why that $75 million wasn't spent, as obviously there's been, in some ways, not enough response to this coronavirus pandemic?
Well, we received the coronavirus money from the federal government at the same time. So the choice was, first of all, the the expiration date on the $75 million from the state was about to expire with my order. And second of all, given the dire state of our state budget, it would seem prudent to spend the federal money first, which we did.
Thank you, Adam. Now to Eric Gunn from Wisconsin Examiner. Eric?
Hi, thank you for taking the question. I'm interested in knowing the thinking behind the decision to take the mask order lawsuit to go straight to the Supreme Court as opposed to waiting for the summary judgment from the lower court that the plaintiffs' lawyers had originally asked for this week were further through the appeal process. Thank you.
Sure. This is Ryan Nelsistuen, Eric, and I'd be happy to answer that. So it was actually in the case brought by the Tavern League, so regarding limitations on public gatherings. The reason for that is, it's a strategic decision based on where that case was situated, that we would get a more expeditious final result from the Wisconsin Supreme Court, because that's where the case was going to end up eventually anyway.
Thank you, Eric. Now to Matt Piper from the Sheboygan Press. Matt?
Hi, yeah, thanks for this call. This isn't a very specific question, I suppose, but I'm just wondering whether it has surprised you in your kind of internal conversations about this, that the increase is so sustained, and whether, back in September and early October, you thought maybe that we were nearing a peak based on some of the age group trends, and I guess why you believe that it has continued to grow.
I'll let Dr. Ostergaard dig in a little on this. I would say more broadly, Matt, right, what we know about this virus is absent vigilant mitigation, right? The strategies that we know work, socially distancing, mask wearing, good hand hygiene, this virus does its thing, and it does it very well. It's very infectious. And so it is teaching us that lesson again and again and again here and across the country as we see cases escalate and we see the number of contacts from each case growing as people are less vigilant about those things like social distancing and gatherings, and the mitigation strategies that we know work. And so I think we can't expect this virus to behave any other way than it knows to behave, which is to spread as quickly as it can at every opportunity. And it speaks more broadly to doing the things we know that work to stop the spread, and doing them now, doing them yesterday, doing them last week, because as we see this escalation, it is taxing our systems. It is taxing public health. It is taxing our healthcare systems. We now have patients at the ACF, right? That was our ultimate insurance policy, and we are utilizing it now. It is not where we want to be, and so we control this virus in as much as we work together to stop the spread by doing the things that we know work, by staying home, by wearing a mask, by physical distancing, by good hand hygiene, by doing the stuff that we know are good public health tactics to stop the spread of this disease. But I don't know, Dr. Westergaard, if you want to jump in with any more detail on the data.
I think you described it well. It's not at all surprising, in the absence of very strenuous effort to prevent it, that this virus spreads throughout the population as fast and as quickly and as widespread as it is. We know this is an extraordinarily contagious virus, and left to its own devices, it will affect 70 to 80% of people in a community. So is it surprising that it can do that? No. Personally, I'm surprised and disappointed that we've been had as low success, or as we've failed as much as we have to slow it. But I think I say that because I think it's important to understand that there's still time to turn this around. We know what to do to reduce transmission, to bend the curve, and we need to do it. So I think if we can look at these numbers and think about how this is not surprising, and given what we know about how many people have been infected already from some antibody surveys, the worst case scenario is that it's really just getting started. It's probably fewer than 10% of Wisconsin residents have been infected, which means 90% are still unexposed and susceptible. So the expectation, if we don't do very aggressive things to slow the spread, is that this could continue and get worse. But I think it's so important that we understand we can actually turn the corner. We can do the things. It's been shown in many other places that even when infection rates are high, that we can turn it around. But we have to really get organized and really do this well very soon, or we would not be, if we don't do that, it would not be surprising for numbers to continue to get worse.
Thank you, Matt.
Thank you.
Now to Jessica Van Egren from Up North News. Jessica.
Yes, I'd like to kind of expound upon what Dr. Westergaard just said in connection with statements made by Speaker Voss last week. What can immediately be done given the number of court case challenges when you talk about the fact that 10% of Wisconsin's population has been infected, but we still have the ability to turn this around. We still have the ability to, get this under control. I guess what immediately can be done given those obstacles you guys have been facing? Thanks.
Yeah, and there have been plenty of obstacles. But just the other day, the speaker talked about the need for more testing. And we agree. We want to, that's why we're doing what we're doing. But in turn, we have always led the country in the amount of testing per person. I received, and I know not everybody can see this little report from the federal government. If you can see this, there's a green area there. And those green areas mean you're doing good. And that's in testing. We have always been in that green area in testing because we have prioritized that. I heard the speaker say that. We need to ramp that up, and we are ramping that up. I also heard the speaker say that we, meaning the Republicans, encourage mask wearing. Well, encouraging but not doing doesn't sell in my book. That is not leadership. How can we have the people of Wisconsin believe that mask wearing is important when we see the president, he's coming into Green Bay today, right? I'll bet you there'll be more than a handful of people in that crowd that aren't wearing a mask. We will hear once again that this is not a good thing. And I'll just use this prompt here just for a second. We receive this every week. See where it says, see the red pieces? That's bad. That means we're not doing, we have not rounded any corner. So if we want to do this right and stop it in its tracks, people have to wear a freaking mask. Simple as that. And how can we convince people to do that? We need to have our leaders wearing a mask when they have fundraisers, as they have, and you see the pictures of 100+ people in a small room, no one wearing a mask. That sends a message that it's not important. Please, leaders, we need to send the message that wearing a mask is the most important part of this equation. And if we are not going to understand that, we will continue to struggle in the state of Wisconsin. We need to wear masks, period.
Thank you, Jessica. Now to Emily Files from Milwaukee Public Radio. Emily.
Hi. My question is about schools. Milwaukee's interim health commissioner said this week that schools that opened in person with mitigation measures haven't contributed to COVID spread. Does that align with what you've seen in the rest of the state? And considering that, but also the rising number of COVID cases in communities, what do you think schools should be doing right now?
Well, I'll jump in there, and I read that, and for the most part, the numbers in schools, K through 12 schools, have been limited as compared to the general population. And so I see schools closing when they need to close for a period of time to make sure that there's enough people in the classrooms to teach. And I also see them making sure that the mitigation things that I'm talking about, the mask, wearing a mask, if there's any group that seems to be doing that in the state of Wisconsin, it's our school kids. And so I haven't seen her data, but she's a very capable person, and I would say that what we're seeing across the state, it's not like it's perfect, but it's messy, but it seems to be in control. And when things need to be changed, school boards are changing it.
Thank you, Emily. Now to Denise Lockwood from Racine County I. Denise?
Yeah, the question that I have is around the election and how the federal government is, the relationship as far as making sure that we have enough the PPE and how we've been able to address these through national efforts. With a Trump administration, is there a mindset around like what you'd like to see different? And if Biden gets, what would you like to see happen with that administration?
I believe I'll try to answer your question. I think around the election, if this is part of the question, not part of the question, I apologize, but I feel that our local clerks have done a great job, and the Wisconsin Elections Commission has done a great job as far as PPE for this election. We've had several dry runs here, not real runs, last April. Then we had two smaller elections, a primary and another election up north this summer. And so everybody's kind of figuring out exactly how to keep people safe. So I'm very confident that first of all, we're obviously having a lot of mail-in ballots, and so that takes care of a lot of the people in the state of Wisconsin. But for those who are voting in person now, I believe it's safe. The PPE is in good shape. The making sure that people stand 6 feet apart is in good shape. The clerks are ready, so I feel that this election can go off in a really safe way. If the question was about PPE in general and who wins is some kind of determining factor on that, I believe that the president or the vice president has made a compelling case that he believes that this COVID-19 is a thing, and that he wants to make sure the people of the country are safe. The president has been saying that we've rounded the corner, and there's very little or no data to support that. And so, I'm a Democrat. I'm supporting Mr. Biden, but at the end of the day, we have to have leadership that understands the seriousness of this situation.
Thank you, Denise. Now to Stephanie Hoff from West Politics. Stephanie.
Good morning, and thank you for taking my call. My question is for Governor Tony Evers. Why are you welcoming Joe Biden to campaign in Wisconsin, but are critical of President Trump coming to the state?
Well, this is Governor Tony Evers here. There's a huge difference between. See, I didn't disinvite President Trump. I just asked him and his campaign. Through the media, I asked them to make sure that their people that come wear a mask and they're physically distant. I couldn't stop them even if I wanted to, and political voice is something that's guaranteed under the First Amendment. So and clearly that hasn't happened. I'm sure it won't happen today. I've seen how the Biden campaign has dealt with this in a really proactive way. Small crowds, people being in cars, instead of shouting and screaming, they're beeping their horns. You know, I'm not saying those are one campaign is more effective than the other. All I'm saying is one campaign is sure the hell more safe than the other. And so I don't see any hypocrisy there. I don't invite people to come or not come, but if they do come, I want them to make sure the people that are supporting them and are and coming to these events are safe. Pretty simple.
Thank you, Stephanie. Now to Mitchell Schmidt from the Wisconsin State Journal. Mitchell.
Yeah, thank you very much for the call today. I was just wondering if we can get an update on kind of where the state stands right now on CARES Act funds. And if Congress fails to pass a second round of that, is there a point where the state is going to have to kind of address those COVID-19 expenses directly? Thank you.
Yes, and as you've seen, this last couple of weeks, we've been putting out information around our how much has been spent and obligated, and almost all of it has been obligated. There's a small amount, but we have ongoing costs now that we certainly need to make sure are covered, such as the facility in Milwaukee and testing and PPE. So the basics will be covered, and the money is almost gone, or obligated to be gone. So yes, we're going to need something. We're going to need money after the first of the year. The CARES Act ends on 12/31. Whatever money we had received from the CARES Act will be gone by that time, and we will have obligations around moral obligations around making sure that we have the equipment and the testing in place so that we can continue this fight against the virus. So that will either have to come from state government or federal government. State government needs to balance its budget. The federal government does not. And certainly they have more access to resources than the state government. So I'm encouraging people at home and in the political world to make sure that they're harassing their federal folks, to encourage them to get another bill together. This is a national emergency. We need national response.
Thank you, Mitchell. Now to Bruce Marcus from WRJO in Eagle River. Bruce? Bruce Marcus? Okay, we'll move on then to Matt Cash from WKOW-TV in Madison. Matt?
Hi. Just to follow up with the new testing site announcement, obviously contact tracing is the next step, but what are some of the next steps following that people need to do once they get tested? Can you expand on that a little bit?
Sure, and I'll ask Dr. Westergaard to pile on as well. The testing as a fundamental part of the response is not protective, nor is it preventive, right? It gives you information that then is actionable to help stop the spread. And so if you go get a test, you should quarantine while you're awaiting results. Once you get your result, you should isolate if you test positive for the appropriate duration, monitoring your symptoms, being in touch with your healthcare provider about how you're feeling, and you should let your close contacts know. Our contact tracers who are maxed out, who have more work and a larger workload because of the number of daily cases we're seeing than they can handle, will get to contact tracing as quickly as they can, but it is why it is important for folks who test positive who receive a test, alert their close contacts so that they can take action to get tested and to quarantine themselves, so that, again, we are pulling out of general circulation people who might be infected with COVID-19. And so all of those downstream actions from testing, isolating, quarantining, and that includes people in your household. You need to not have contact with folks in your household. We certainly see household spread as a factor in what we're seeing in this outbreak right now. Right, those shared surfaces in homes, shared bathrooms. Everybody's reaching into the same silverware drawer for a fork and a knife, right? Those kinds of contacts help spread the disease. So you need safe isolation away from other household members. But Ryan, if you want to dig into any of this that you think I've missed, I'd welcome it.
Yeah, thank you. Those are all great points. One additional concept I think it's a good opportunity to emphasize is what testing, one limitation of testing that relates to the incubation period of the virus. So that's kind of a jargony term, but what it means is that if someone's in close contact with a person who's infected, they may have been infected, but they may not test positive. They may not have symptoms develop for as long as 2 weeks afterwards. So one sort of misconception that we have to talk about with both healthcare providers and the public is that if someone is exposed, if someone is in close contact, is in the same household as someone who tests positive, we do want them to get tested. But if they test negative on day 2 after their exposure, they're still at risk of becoming infected for the next 10 to 12 days. So that's when we talk about quarantine. That's the important issue, is that an exposed person might test negative early on, but then turn positive later. So staying out of close contact or quarantining when you've been exposed is a really important element of this. So when people come to community testing sites, that's some of the education that we give them, so they know what it means if they test positive or negative. A positive test is sort of easier to understand. It means you have the infection and you're contagious. But that other piece is a little more complicated. If you're getting tested because you were exposed to a person, even if you test negative, you're not out of the woods yet. You need to stay out of close contact throughout that quarantine period, what we call the incubation period of the virus, the time between when you get exposed to the virus and might develop the infection, which frustratingly can be as long as 2 weeks for this particular virus. So that's a couple other points that we want to highlight related to the testing and contact tracing and isolation that we have to communicate to people.
Thank you, Matt. Now to Mason Dowling from WAOW-TV in Wausau. Mason.
Hi, our question has actually already been asked, so we will pass. Thank you.
Okay, thank you, Mason. Molly Beck from the Milwaukee Journal-Sentinel. Molly?
Hi, thanks for having this call again. So this surge is starting to feel just like how things are now. And when you look at the mobility data, people are out and about at rates similar to early March. And it seems like telling people to stay home doesn't seem to be working. And obviously not everyone is wearing masks. I know all of the health orders have been challenged in court, but I'm wondering if there are any further mitigation efforts you're planning to take or to propose to the Rules Committee, or just to propose to float out there to put required restrictions on public interaction, or maybe changes in the state law that can keep businesses open but people at home to try to slow this down?
We're always looking at any opportunity to stop this in its tracks. The unfortunate thing, as you had mentioned, is that the things that work elsewhere don't seem to be working here because we're having difficulty with compliance around the very basic things. And so we will continue to fight those issues and hopefully have requirements in place that people understand how important they are. Me shouting here every once a week gets old hat for me too, folks, but if we do the simple things, we'll be in a much better place. But that said, possibility of rulemaking, possibility of legislation, clearly we spend all our time messing around with the courts, and that's time consuming and it's very expensive. At the end of the day, we may need to do something as far as passing a law around, some legislation around these things. Certainly, if the federal government doesn't help out, we'll need money from the state. I'm not sure where it'll come from, but we will need money from the state. So there's always opportunities for the legislature and the governor to do some things, but at the end of the day, Molly, it is around the basics, and we can kind of nibble around the edges in some other ways, but whatever we can do to convince people to do the right thing, whether it's in situations like this with the governor yelling at people, or if it's legislation where it shows that the people of Wisconsin, their representatives are behind the basics, I'm open to it. We've waited a long time for a plan that the Republicans were going to put into place in last April. Haven't seen it yet. We hear some rumblings now that they're okay with testing and want us to increase it, and we have been testing. We will continue to increase those tests. But if there's some other ideas that they have that would help all of us convince people to do the basics, I'm open to that.
Thank you, Molly. Now to Nate Vandergrift from WBAY-TV in Green Bay. Nate?
Hi, thank you for taking my question. Building off of some of the previous questions, with the rallies and campaign events that have been happening across our state leading into the election, have the campaigns been working with state health officials, and what does that communication look like?
I can't say for sure as far as the campaigns. They're doing their thing, and the only thing I can tell you is that we encourage them to do the things we want all Wisconsinites to do. If you're coming to town, make sure the people that are with you are following whatever orders are still in place regarding masks and social distancing, and we want them to abide by that. We can't control them, and so there's no specific communication that happens between our health officials and either campaign that I'm aware of, but you can certainly see the difference in how those events play out.
Thank you. Now to Azal Razai from Spectrum News 1. Azal?
Yes, thank you for having this call. So I'm just wondering if there's been any conversations at the state level, just getting prepared for obviously Halloween weekend and then the election that's going to follow. What are things going to look like here in the next couple of weeks, trying to kind of get past that?
Trying to get what? I'm sorry. Past it. Oh. Well, I think... the bottom line is it's the things we've been talking about. People need to limit their contact with other Wisconsinites to the people that they live with. We've got significant community transmission, including asymptomatic transmission. And so us doing everything we can to stop the spread collectively as a community, as a state, is what we have to do. There aren't ways around that. We've got to get together and do the work we need to do as a state to stop the spread. And whether it's yesterday, last week, tomorrow, next Wednesday, that remains true.
Yeah, and you mentioned both those events, Halloween and the election. I'll start with the election. I mentioned this before. Obviously, it's an important piece of our democracy. We want people to participate in the democratic in our democracy, and part of that democracy is elections. And as I mentioned before, that God bless the clerks and other elected officials or election officials at the local level and at the state level. They've done a great job. We've had several kind of trial runs on how you vote during a pandemic, and they've went well, and we're continuing to make sure that our polling places are safe and healthy places to go. And so I feel confident that with the right precautions that are in place already, and the precautions that voters will take as far as wearing a mask and staying distant and while you're waiting in line, it will be a safe, important thing to do. As it relates to Halloween, as Secretary-designate Palm talked about, it's back to the basics. We are concerned about the interactions that happen, whether it's Halloween or any other time of the year, and so we minimize those. And there's lots of ways to virtually do Halloween, and we encourage to do that. And you have to be safe, and this is a real significant time.
Thank you. Now to Mark Stevens from CBS 58. Mark?
This question is for the Secretary and Dr. Westergaard. It's kind of complex, so I'm trying to keep it simple. I'm surprised there haven't been more transfers to the state fairgrounds facility. Are the hospitals that are overwhelmed, are the patients not stable enough to transfer? I'm not sure what the age range is. I mean, what's kind of going on in that interplay?
Yeah, I appreciate the question. I think, right, this is a very dynamic thing, and one of the important things we did as a state in the spring when we were all staying safer at home was we gave our healthcare and hospital systems the time to do the planning and the work they needed to do at the regional and local and system level to make surge plans. And so they have all done that really important work. And so they, through their regions, through their local partnerships, through the work across their systems, are actively manage their capacity. They bring beds online. They shift beds to higher acuity levels. Maybe it was a clinic setting. Now it can serve as a higher level of care setting. They're managing their staffing issues so that it's not just right about beds, it's about do you have the people to staff them. And so they are very, very actively trying to keep as many patients as they can manage within their system, within their community, within their region, and that's what surge planning is all about. And the alternate care facility is able to take lower acuity patients. We have made a number of adjustments to our eligibility criteria based on feedback we've received from hospitals, so that we can meet the needs and demands of the hospital systems and what they're seeing and how they are finding ways that we can be helpful to them in this space. But I think, right, it certainly is everybody's preference that if you need hospitalization, you are able to stay in a hospital that is closer to home, closer to your community, closer to the doctors that you are regularly treated by. And so we are seeing an increase and are having more and more conversations with hospitals across the state as they understand how to use the alternate care facility, as they come to a place where they might need to transfer patients. There are very active conversations between our chief medical officer at the ACF and chief medical officers and nursing officers around the state as people are managing their patient caseloads. And we are starting to see our census grow at the alternate care facility. But again, it speaks more broadly to the work we need to do to prevent hospitalizations in the first place, which is wearing a mask and socially distancing and staying home as much as possible, the things we know we need to do. But it really is a very dynamic situation between hospitals, among hospitals, across regions, and then ultimately with the alternate care facility if they can't and don't have access to ready solutions within those communities, systems, and regions.
Thank you, Mark. Now to Mel Meyer from News 8 in La Crosse. Mel? and Mel Meyer from News 8 in La Crosse. Okay, we'll move on then to Aaron Mabin from Fox 6 in Milwaukee. Aaron?
Hi there. Good morning. Thank you for having this call today. I'm just curious about the new numbers that we're seeing, especially in the last month to 2 week range. Is there a certain population or age group that seems to be driving these new numbers that we're seeing today?
We're seeing widespread transmission across the age groups. In early September, it was in our sort of 20 to 24 crew. We are seeing a little bit greater transmission, greater numbers of positive cases in the next age group up. So I'm forgetting the exact range, whether it's 24 to 34 or 29 to 34, but there's that age group just sort of out of college, early adulthood, where we're seeing a little bit higher daily case rates than some of the other age groups. But it really, I think the broad message here is that it is spreading in all age groups in the state of Wisconsin, in every community in the state of Wisconsin, in every corner of the state of Wisconsin. And so the idea that gatherings are safe, or that other things that we might want to do outside of our immediate household are safe, the data just is not bearing that out, and we need to do everything we can to slow the spread, and that means stay home as much as possible, wear a mask, and physical distance.
Thank you, Erin. Now to Emily Davies from WSAW-TV in Wausau. Emily.
Thank you for taking my call. My question is again related to the election, and you've answered it a few times, but I want to ask it in a different way. So the National Bureau of Economic Research looked at Wisconsin's April election and found a statistically significant association between in-person voting and COVID-19 spread. Granted, we look different now than we did at that election. We are more prepared for this election, obviously, but we also have greater spread. And while there are orders in place, voters aren't required to wear masks. They can't be denied a ballot for not wearing a mask. And people like to watch and observe the election process. So is there a concern about in-person voting on election day and spreading the virus, especially since we have another holiday ahead of time, and especially if people decide not to follow state guidelines?
I believe the answer to that question is no. I'm not concerned about that. Certainly, anytime you walk out of the house, you're in this situation. It's an issue, but it's much different. How many? There were polling places in Green Bay and Milwaukee that were just, I don't know the numbers, but they're very, very small and had large numbers of people standing in line, and it was much more difficult to socially distant. And now the number of polling places has expanded dramatically in all places, all towns across the state, cities across the state in particular. And so that social distancing is going to be available to people. So I think it's much, much more different than what we saw in April. And people are more aware. And so I believe that it will be safe. We're encouraging people, obviously, to vote in person beforehand, so that the lines might be smaller. But lots of people, large numbers, have voted already by mail, including Kathy Evers and Tony Evers. And so we won't be taking up space on the lines. So I believe that the situations are much different, and clearly the clerks and the elected officials locally are ready for it, and it will go well.
Thank you, Emily. Now to Steve Hansen from WIS Community. Steve?
Hi, thank you for taking this call today. All of my questions have already been answered, so I will pass.
All right, thank you. And our final question today belongs to TMJ4, no name given, TMJ4 in Milwaukee. WTMJ. Okay, then with that concludes this morning's briefing. Please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a good day.
This program is a production of Wisconsin Eye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. Wisconsin Eye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.